Good afternoon. I'd like to call the Finance, Ways and Means Committee to order for January 30th, 2023. Madam Clerk, would you please call the roll?
Representatives Barrett, Boyd, Campbell, Camper, Cochran, Crawford, Faison, Freeman, Gant, Garrett, Hawk, Hicks, Kiesling, Lamberth, Love, Lynn, McKenzie, Miller, Moon, Parkinson, Shaw, Sparks, Whitson, Williams, Zachary, Vice Chairman Baum, Chair Lady Hazelwood.
Here.
Madam Chair, you have a quorum.
Thank you, Madam Clerk. Are there any personal orders or announcements before we get underway? Right. Seeing none, today we're going to hear from the Department of Children's Services. The presentation today from the department will be about the redirection of some funding that will be covered in the supplemental budget, but it is a significant amount of funding, and felt it was important for this committee and for the public to understand how those dollars are going to be redirected, where the dollars are coming from, and where they will be going. With that, I'd like to ask Commissioner Quinn and her team if they would come forward. Members, you do have the information. The presentation from the department is on dashboard, so you should be able to access it there. And without objection, we are out of session and we'll go into the presentation. So, Commissioner Quinn, thank you again for being with us here today. And if you would introduce your team, and then we'll just ask you to begin your presentation.
Thank you. Good afternoon, Chair Lady Hazelwood, distinguished members of the House Finance, Ways and Means Committee. I'm Margie Quinn, Commissioner of the Department of Children's Services. Also with me today is Department of Finance and Administration Budget Director Dave Thurman, DCS Chief of Staff Andy Verinsky, and DCS Assistant Commissioner Mohammed El Casey. DCS's mission to provide high-quality prevention and support services to children and families that promote safety, permanency, and well-being is reflected in the supplemental budget request. It is no secret that DCS has failed to hire and retain staff, and as a result has seen unusually high caseload averages throughout the state, especially in hard-hit staffing areas like Davidson County. The women and men working with DCS have the potential for the most positive impact on our services. Our commitment is to give our employees the tools to solve problems, to build a team that does rigorous work, to reward their efforts, and to be an agency they want to serve well. Since my appointment last September, I've spoken candidly about DCS's challenges to hire and retain great employees, place children throughout the provider network, and find forever homes for hard-to-place teens and children with high needs. Our focus is on ensuring that everything we do has a positive impact in a child's life. Our supplemental budget request has three primary goals: to reduce children and youth from offices in transitional homes immediately by increasing bed capacity in the provider network, to create incentives so teens and sibling groups find foster families, to improve our retention of great employees and improve our turnover rate by smartly adjusting workloads, and serve more Tennessee children. Slide 2, please. By increasing the provider rate, Tennessee is able to compete in the market with other states who are paying more per day, per bed than we are, as much as $100 per day. Increasing 118 beds in the network allows DCS to place youth and reduce their time in offices in transitional homes. They receive services. It also reduces the time case managers are sitting in offices with children, so it reduces their workload. Right now, the department sends youth out of state for clinical assessment. We need to build capacity in this state. With 48 beds strategically located across, immediately access an assessment placement where clinical, medical, and educational needs are met. At the conclusion of the 30-day placement, the best first and next placement will occur. Tennessee teens and large sibling groups are difficult to place and disrupt placement frequently. With an increase in incentive rates, current and veteran foster families will be sought for this new program. 400 children and youth will benefit from this new program. Slide 3. The supplemental request is an additional $26.6 million to begin services right now. That breaks down to $7.7 million in state funds, $800,000 in federal funds, and $18.1 million in TennCare funds. These funds will help us implement strategies that will significantly impact Tennessee's children as well as DCS case managers. Thank you for the opportunity to present our supplemental request to you. Your support will mean immediate reduction of children in state offices and stabilization of the provider network. When case managers aren't sitting in offices and transitional houses with children and youth, they can do the job they were hired to do: manage their caseload, see the children, and pour resources into families. They can serve more Tennessee children, reduce workload, which will improve our recruitment and retention, which directly addresses the findings in the 2022 Comptroller audit. Measurable and meaningful improvements will happen with the collaboration of many agencies, the support of our legislators and Governor Lee, and a dedicated team at the Department of Children's Services. A great first placement for children and youth provides the greatest potential for long-term success. Our primary goal is to ensure that every child in our state has a loving, permanent home, and my commitment is for positive impacts in a child's life. I welcome your questions.
Thank you, Commissioner. And before we begin questions, just a couple of ground rules. This is not our DCS budget hearing. We will have that at a later date in our regular scheduled budget hearings. And at that time, we'll have an opportunity to dig down. I know there are many questions that all of us have about DCS operations and the impact on the most vulnerable citizens in Tennessee, but this is not the venue for that. Today, we are here to talk about this redirection of supplemental funding and the impact. I think it is a fair question to know how these changes will impact the budget going forward, because some of these are redirecting current funds now, but they will be recurring dollars going forward. So I think that's an issue that we need to understand as well. Before we get underway, I just have some questions. If you can go back on the funding amounts. The information that I have shows that TennCare funding, okay, there we are, $18.1 million, the state 7.7, and federal just under 800,000. Normally, as we understand budget breakdowns in DCS, TennCare normally is 45% of DCS funding. My mic is on, but am I not speaking clearly into it? Sorry. Okay. Normally TennCare provides about 45% of DCS funding. In this scenario, in these supplemental dollars, there's about 70%, 68 to 70% that's coming from the TennCare budget. Normally, the state portion of DCS funding is around 29%, 30%, something like that. I'm sorry, that's what this is, 28 to 29%. Normally, the state funding is 45%, and normally federal funding is 15%, but it's only 3% of this. So can you help us understand how these allocations are different? Mr. Thurman, I see that you're ready to go.
Right. So you're correct. So what this chart is showing you, without getting into too much detail, is the TennCare effect of what we're proposing to do. And so if you take that to the next level of funding, you're correct that for TennCare, I would think about that as almost a 50-50 split. So we'll in the budget we're going to roll out in a couple of weeks, you'll see a supplemental that'll address this item. It'll be about $13 million in state dollars. 7 of it will be in DCS, and the difference will be in TennCare. TennCare, puts their dollars together with federal dollars, and that's what comes to DCS as other. So we just didn't show you all that detail, but you're correct.
All right. And I know we have a number of questions, but just a moment. All right, we're probably going to, Mr. Thurman, we may need to get our budget analysts and your folks together to help us make sure that we're understanding these moving parts clearly, because I'm easily confused. Right now, I'm a bit confused. And members, before we begin our questions, I do want to remind you the subject matter is these supplemental dollars, how they're being directed, how they're being spent. We're not going to go down other rabbit trails and get off into other issues regarding DCS. That will, again, we'll have an opportunity for that at another time. So with that, I'll start with our list of questioners. And first on my list is Chairman Baum.
Thank you, Madam Chair, and thank you for your comments, Commissioner Quinn. We've worked together on some other initiatives prior to this, and I know your heart's in a place to help children. I've got a couple of questions about the supplemental budget request. 7.7 million is in state funding. Can you tell us a little more about the source of these state dollars?
So it'll come, you'll see this in the budget we roll out in 2 weeks. It'll be funded from a non-recurring revenue that we will show you in the document. But it's really a result of over collections of revenue and underspending in the prior years.
Is any of it unused salary dollars?
Well, so when I'm talking about non-recurring dollars, it's coming from underspending in payroll and non-payroll, but also we're combining it with over collections of tax revenue. So I can't tell you what color the dollar is exactly, but it's a combination of all those different things that result in a non-recurring available balance to do these kinds of things.
Okay. Kind of another set of budget questions. Have any of these dollars already been spent? In other words, have you started some of these initiatives and begun expending dollars on some of the items in this supplemental budget proposal?
No, we have not begun spending the money yet.
Okay. And last question,
I'm sorry, just a follow-up to that. When would you expect these expenditures to begin?
As soon as possible. As soon as we get the go-ahead
Okay,
to do
thank
so.
you. Chairman Baum.
and then just one last question. 800,000 of this supplemental request is federal dollars. You've identified that. Do you have any additional information on the source of that federal funding?
The source of federal funding will be Title 4E that pays for room and board. That is the source for the funding.
And do you have any sense of whether this is a stable funding source or whether it fluctuates, it's year to year?
This is entitlement, so it is very stable.
Okay, thank you.
Chairman Williams.
Thank you, Chair Lady. Thank you for coming today. I did have a couple questions I thought maybe you could ask, but the first being, I saw on the bulleted points we have listed on the dashboard, maybe different than yours, but on the one where it has the 3 parts and then it has a very interesting asterisk at the bottom, says addresses multiple findings as it relates to the comptroller's report. Can you just share with me 1 or 2 items that you guys have addressed and how you've addressed it as it relates to the comptroller's report?
So the comptroller report there were a number of things in the comptroller report having to do with turnover and retention of case managers, sitting with children in transitional homes and offices, increases workload tremendously for our case managers. We think that has a direct impact on turnover. We see that in the exit interviews. In 2021, obviously, the comptroller reported 97% turnover. That's been widely reported. In the exit interviews, we know that the top 3 reasons that DCS case managers are leaving is workload and overload. The second is supervisors and leadership. The third is money. And so we think this will have a direct impact by reducing the number of kids in offices and transitional houses and reducing their burdens and workload. We think this will have a direct impact on their work and their overload. The second was equity when it comes to what kids had available to them. So in other words, when kids are coming into custody, where they're coming into custody and what they had access to, and with regards to transitional homes or offices. When kids have access to assessment homes and assessment beds, and they're undergoing clinical assessment, medical assessment, educational assessment, and there's equity across the state, we think that addresses the comptroller finding of equity throughout the state for children coming into custody. I think those directly address the comptroller findings.
Thank you. Follow-up question. Thank you. You did mention in this first bullet point that some of the surrounding states are paying higher rates and sometimes as much as 100. I know your budget, the supplemental budget reflects an increase. What are you proposing in this to increase hours? What dollar number or percentage? And do you feel like that's enough to really move the needle if we give you, if the starting gun goes off tomorrow?
I think that's a great question. And I talked about that with the governor in my original budget hearing with him. And I sat at the table and negotiated these rates with the providers. And all I can tell you is that states like Mississippi and Wisconsin are paying upwards of $100 or more per day per bed than we are. We've just not kept up with the market in these cases. I think it's a fair question to ask us, well, if we pay $100 more per day, is Mississippi or Wisconsin just not going to then turn around and pay $100 more a day after we up ours $100? And all I can tell you is the market is going to do what the market is going to do. But the position that we're in right now is that we can't get our kids into the services that we need to get them into. So we have to increase the rates that we're paying. We have some assurances right now from our providers that with these adjusted rates, we will be able to increase somewhere between 20 to 30% within our capacity across the state. And we think that's going to be sufficient to see a significant reduction of the kids within our offices.
One final.
And just to follow up on that, when we talk about the 20 to 30% capacity, what is the capacity of our beds now, and what are those numbers?
So out of about the 8,400 dependent and neglect kids in DCS custody, right now we have approximately 1,400 children in residential placement, and that includes juvenile justice. Right now we have 170 children placed in out-of-state placements because we do not have the capacity within our state. Obviously, we would love to draw down that number over time so that we are not placing children out of state. We'd love to, again, we need the capacity in our state so that we're not having to send kids out of state to get the kind of services we need for the children in the state of Tennessee.
Chairman Williams, and then I have a follow-up.
Thank you. One final question, Commissioner. You stated that with these revisions to supplemental that you would be able to reduce the number of children that are housed in DCS offices across the state in those transitional homes. I guess the question then begs, what would it take to eliminate it?
Right. That is the magic question. And right now we see between 3 and 30 kids per night in offices and transitional homes. That number is reducing because we can't control the number of children who come into custody on a nightly basis. And we see the acuity increasing exponentially. In other words, the needs of children, behavioral and mental health needs, rising. It's hard to predict what that number is going to be. We know that this will move the needle. This is going to be progress. I'm not going to sit here and tell you that this is going to fix it. I'll know more in 6 to 9 months where this is going to get us, and be able to do a little bit better predictive analysis on where this is going to land us. I don't think this is going to fix the problem, but this is going to move the needle.
And back to the out-of-state, the work that we're doing here, this increase, supplemental budget increase, how many of those 107 that are currently out of state do you expect to be able to bring back, say, within the next 6 months? And do we have capacity in the state to bring them back?
So, and that's kind of tricky. I don't think our folks would tell you would want to disrupt placement if treatment's going well for a child out of state. But once treatment is completed and you bring a child back, what you want to do is slowly over time reduce the number of children you send out of state, because you're gonna build capacity within the state. So it's not that you're going to immediately bring children back, but once services are complete and children return, we're not going to send children back to that particular location. We want to slowly reduce our reliance on out-of-state placement by increasing our capacity within the state.
And are there qualified providers in the state that we can
Absolutely.
rely on to provide that capacity?
Absolutely.
Thank you. Chairman Zachary.
Thank you, Madam Chair, Commissioner and team. Thank you guys for being here. Questions related to the 48 assessments beds. Where are those beds going to be located? And a couple of questions related to that. Where are the beds going to be located? Where is the greatest need in the state? And then are these existing providers or are they new providers related to these beds?
So these are going to be built out through our existing provider network. These are, we are talking with our current providers, and they're going to be building out this capacity for us specifically in the state. These are not beds that have currently, they are not currently in existence, but they're going to be built for us specifically within our current provider network.
Okay. And then where are the locations?
They'll
Those-
be in the mega regions. So what in the sort of west, east, west, middle, east, upper east.
And is that an equitable distribution, or are you actually going to the need? And if it is more just equitable to try to be fair to each region, where is the greatest need in the state for additional beds?
So we will start probably with an equitable distribution and be able to adjust based on need.
And so where is the greatest need right now?
That's hard. That's hard to say. It fluctuates. Right now, I'd say our greatest need is in the Upper East region, but that sometimes is based on different juvenile judges bring different kids into custody, and it really depends on the juvenile judge and whether or not they're bringing children into custody.
Couple more, Madam Chair, if I may.
Certainly, Chairman Zachary, continue.
How many providers? So you said these are existing providers. How many providers do we actually have in the state, bed providers?
We have about 31 providers around the state.
I was going to say 30. Yeah.
30, did you say about 30?
30 years.
Okay. And so then how do you determine which providers provide for the additional beds?
Those would be based on their ability to conduct a clinical assessment. So it would be based on their ability to conduct that deep clinical assessment, also based on their capacity to reserve the beds for us.
And then last one, Madam Chair, if I may. What is the vetting process for these providers? I know they're existing, but as you look to add these 48 additional beds to ensure that these beds, you talked about equitable distribution, but as we vet these providers and look at what the greatest impact will be, how do we do that to ensure these beds are put with the best possible providers?
So these are providers that have already gone through a vetting process and a licensure process. So these are already licensed providers.
And so these additional 48 beds, these beds, if I read correctly, are for medical and mental health treatment services, correct?
That's correct.
So
And
these providers have already gone through that vetting process to ensure that they're able to handle these 48 and be effective in the distribution of these.
yes, and we've looked at programs, existing programs in other states who are doing this kind of work already. Also, the Children's Bureau through the federal government, I think, is very much in favor of this type of service. Also has guidelines and best practices, and we're looking at all of those things in order to start this service here in the state.
Thank you, Commissioner. Thank you, Madam Chair.
Chairman Hawk.
Thank you, Madam Chair. Commissioner Quinn and your team, thank you very much for being here. We appreciate that. I want to go down the road of the foster care rate increases. Hopefully, by creating a more robust foster care network in Tennessee, we may be able to relieve some of the concerns that Chairman Williams expressed earlier about kids staying overnight in DCS offices or transition houses. Commissioner, if you could, let's break down the dollars. I see we've got $2.1 million for the foster care rate increases and incentives, $1.7 million state funding, $434,000 federal funding. How is that going to be broken down in terms of possible incentives? Is there an incentive for a hard-to-place child? Or if you can break that program down for me, how we're going to spend those dollars?
Yes, sir. We are going to be increasing our rate for teens and large sibling groups. That will go from $29, $30 a day to $50 a day. And then if those children or sibling groups remain in placement for 6 months, they'll receive a $2,000 bonus. We looked at some of what states were doing around the country and borrowed this program from Georgia, who was working this program successfully in Georgia. We really started to look around the country at what some of the other states were doing because, again, this is a difficult population to place, teens and large sibling groups. And we are already the second highest foster rate state in the country. So we know that we're paying very competitive foster rates. But we want to be careful not to make this just a money-making venture. But again, teens and large sibling groups are incredibly challenging to place. But teens and large sibling groups are expensive. I have a teenager myself, and she's expensive. And so we do want to incentivize families to consider teens and sibling groups.
Chairman Hawk.
Thank you, Madam Chair. I do have a follow-up question that I've got an 11-year-old and she just got the dress for daddy-daughter dance. So I know how expensive your teenagers can be. So
Right.
very much. Ma'am, as we're talking about the budget, and this budget in particular, I've been made aware of a specific instance where the Tennessee Bureau of Investigation has gotten involved in an internal investigation of DCS employees and former DCS employees. Are any of these supplemental dollars going toward any TBI investigations, or can we talk about that in 2 weeks?
To my knowledge, no funding is going to any DCS or TBI investigation, no.
Just one follow-up, madam.
Chairman Hawk, that really is outside the purview, I think, of these supplemental dollars.
Thank
We
you,
will-
Madam Chair. I'll cease and desist. Thank you.
We will have ample time to talk about that in our budget hearing. We will have more time with Commissioner Quinn and her team. Leader Cochran, you're next on my list.
Thank you, Madam Chair. Commissioner, so just a quick question, just regarding the initiatives that you've discussed here this afternoon, and then how they are funding. And so ultimately, do you think that TennCare funding is consistent enough to cover these initiatives, or at some point, do you see that it will require additional state funding to make up for some deficit in TennCare?
I don't think it won't cause a deficit in TennCare at all. I don't see that at all.
So just a quick follow-up, Madam Chair, if you don't mind. So you don't foresee any additional state funding being necessary? You think your current TennCare funding is enough for the initiatives that we've discussed here today?
Yeah, so just to be clear, so what we're talking about today is a plan that Commissioner Quinn wants to enact today. So we're going to have a supplemental to fund what she's talking about. But when we do that, you're going to see in the budget also a recurring cost increase to annualize this plan. So you'll see state dollars for the current year that we're adding, but also annualizing it with state dollars on a recurring basis for next year.
Okay, thank you.
And Mr. Thurman, can you share with us what those recurring dollars, the impact of these particular programs on for recurring dollars going forward that we'll be looking at in the new budget?
Yeah, can you come back to me and let me look for it? Okay, so for the 24 budget, you'll see an annualized recurring cost increase of about 17 million in DCS in TennCare. And then, let's see. Let's see, I think 2 million in DCS appropriation budget as well. So again, combine the dollars in both TennCare and DCS. Did I miss anything? Did I miss anything? Okay.
All right, thank you. Next on my list, Representative McKenzie.
Thank you, Madam Chair, and thank you all for one, acknowledging the need for supplemental request and for what you presented here. A question along with Chairman Hall's question about the foster care. Does this supplemental request include any additional expansion of scope or increase in funds for the relative caregiver program that we had passed last year?
No, sir, it doesn't.
You know, as you say, you struggle with our children that are in this position and predicament. You know, having someone close to the family who, with a few dollars, might actually be able to take this family, I mean, these children or these groups of children in, would be an asset. And just expanding that great program that was recently passed by the last assembly would be something to strongly consider. You know, you go to the Walmart and you just see a lot of our grandparents and great aunts and folks are taking care of these children. So just in the supplemental request, that might be something you all could take a look at.
Representative McKenzie, go ahead.
Thank you. A second question is, and I don't know if we jumped into it here. Is there any increase of another part of the problem is us being able to attract and retain, you know, quality employees? Are there any supplemental dollars that go out for that? And could you kind of explain briefly, if so, what those are?
I'm sorry, can you repeat the question?
Okay, I'm asking about the employees, the pay rate for our state employees that are actively engaged with these children. Are there any supplemental dollars that you're requesting that goes to their salary, increasing, changing the scale of their salary, and putting them on par with what other states and entities are providing?
Right now, the starting salary is $43,900 for DCS case managers. This time last year, they were at $35,000. I have consistently advocated for pay increases for DCS caseworkers. The governor's budget is coming out on Monday, and I asked for $15.8 million for salary increases, and so we will see what the governor's budget includes on Monday.
Representative McKenzie.
Just thank you, Madam Chair, and just one more quick question. You talked about this addresses multiple findings, and you don't have to go into any detail. Did this supplemental request address the complete number of findings from the comptroller, or are there still, I guess, financial findings? Maybe I say it that way. Or are there still financial findings out there? And if it doesn't, why not address them all right now with this request?
There are several other findings that this supplemental does not address. We are addressing all of those in the next year, and we'll be reporting back to the Government Operations Committee 4 times over the next year with reports to them.
Representative McKenzie, did you, I guess a quick follow-up. So there's no change. This supplemental budget that we're looking at here is not going to change the pay scale for any of the DCS caseworkers at this point?
No, ma'am.
Okay. So the only change would be that was already instituted by the market rate study?
That is correct.
All right, because my understanding was something different. All right, thank you, Representative Parkinson.
Thank you, Madam Chair, and thank you, Commissioner. The 48 beds, where are those beds going to be located?
So they will be located strategically across the state and each grand division.
And how many will be in Shelby County of that 48?
Those will be, depends on the provider that we utilize in Shelby County. I imagine some will be with Youth Villages on the Bartley campus, but we'll have to negotiate that with them. So TBD, to be determined.
Okay, so we don't, at this point, we don't know exactly how the beds are going to be distributed across the state, and
There'll be 16 in each grand division.
Okay,
So
okay,
there'll be at least 16 in West Tennessee.
okay, thank you, ma'am.
All right, I don't see any other questions. Again, oh, I'm sorry. Representative Miller, I did not see your hand.
Thank you, Madam Chair Lady. Just a quick question on the supplemental breakdown. See what federal is 791,000, and then TennCare is 18.1. Are the TennCare dollars, what percentage are actual federal and what percentage of 18 for state?
It's about,
Go ahead.
about 66% federal, and the state match is about 34, roughly.
Okay. And on the federal 791, that's 100%.
That's
Federal.
100% federal.
So do you apply for those through grant proposals? Why is it so low? I guess my question.
The federal piece is an entitlement, so it's always tied to the level of service or the service we're providing. So they are low because the other placement that's going to get the rate increase, they are funded largely by TennCare because they're high level of service of treatment. So the treatment portion of those rates are very high, and the placement, the room and board piece of that is a small. So that is explain why TennCare in this request is much higher than the federal piece.
Well, again, the 791, when you apply for those, there's a restriction of the amount again that you can request, or? I was
No,
just
there is
curious
no
about that.
restriction. Its amount is tied to the level of service, and those are the cost of the room and board on the rate. So those are the $700. Some of the level of service are funded 100% by TennCare, so that's why you don't see any federal piece. So the federal piece, of course, will be the TennCare part of it.
Okay, thank you, ma'am.
And just for clarity, I believe on the federal funds, we've talked about that a few times, and it's Title IV-E funding. So just because not all of us know what Title IV-E is off the top of our heads, if someone could just kind of give us an overview of what that pot of money actually is, how it's just defined.
So Title IV-E in general, it pays for room and board portion. So for example, adoption assistance, this is one of the payment the department may pay. There is about 60% or 65% of that rate is paid for room and board, and there is no treatment part for that. When you get to DC, foster care payment, there is no treatment. It's all just room and board. And then when you start getting to high level of treatment, it started to get higher and higher of TennCare, and you get to a point where really is the child going mainly for treatment. So that becomes almost, in some cases, 100% of the payment is funded by TennCare. The only thing will be left is the state match that Director Thurman talked about.
And Director Thurman, I believe you wanted to make a clarification on something you had said earlier.
Yeah, I misspoke earlier when I was reading the wrong line items when I was trying to add dollars in my head. But so for FY24, the state costs, so we're talking about, $13 million in state appropriation for the current year supplemental. And for FY24, we'll have recurring cost increase, again, both in DCS and TennCare. I'm not going to split that out, but a $43 million state. And that'll be put together with federal and other dollars.
So the total budget will grow by $43 million.
State.
State dollars recurring going forward, all right? Representative Garrett, I think you had a question.
Thank you, Madam Chairman. Thank you all for being here. Really appreciate it. I've been trying to figure out how I wanted to ask this question. It just came to me. So bear with me if hopefully this makes sense. I look at the request, $20 million of that is going to go to increasing rates for beds. And I understand that you all have vendors you contract with. Some vendors may not have private pay. There's some issues on how we can, there's no exclusivity, I guess. There's no ones that we have only kids that are in DCS custody. And I understand that. My question is, more money always doesn't mean the results that we want, right? Money solves a lot of problems, but it's not going to solve all of them. And so my question is, how are we guaranteed that we do $100 more per bed is going to open up more beds? I mean, how are we going to know that throwing $20 million more to this is going to be a guarantee that we're going to have more beds? Can't these vendors say no?
They can say no, but we know that $100 less per day is not going to get us more beds. So we know where we are right now. We've negotiated these rates with the vendors, with the providers. We have an agreement with one provider that will go from 56% of DCS kids in his bed in this state to 80% of DCS kids in his beds. So we know that we're going to increase the number of kids in his beds from 56% to 80%. So we know that we're going to put more kids in beds by raising the rates. And we know where we are right now, which is a lot of kids in offices and transitional homes. We're doing what we can now to try to make a difference in the amount of kids that are in offices and transitional homes. That's what we're trying to do right now. And we think we've got to do something right now.
Representative Garrett.
Thank you for that. So that makes me feel better so this supplemental budget request, we're guaranteed to get more beds for these kids.
We are guaranteed to get more beds.
Thank you very much. Appreciate that.
Leader Camper.
Thank you, Madam Chair. Thank you, Commissioner. Good to see you.
Good to see you too.
Question back about foster care. I was under the impression that we had a limited amount of families waiting to, place the children in our care. So do we have a shortage of foster care homes to place the children? And if so, is it directly related to the amount that we're able to supplement the families with? And would this dollar amount help offset that or create the number of placements that we can have?
So we're always looking to recruit foster families. We always can use more foster families. We're a little below 5,000 in the number of foster families. I think there's this idea that the children and youth that are in offices and transitional homes are as a result of a shortage of foster families. And that's not necessarily the case. The kids that are in offices and transitional homes are not waiting on level 1 foster families. They're waiting on placement in these residential facilities. That's why we're here before you today. And that's why the need is immediate. But we do need more foster families. And that's why we're recruiting heavily, because once they return from residential placement, we would like to put them in foster families. We do want these children to find forever homes. Teens and large sibling groups, when they come into custody, are hard to place because most foster families want babies and they want little kids. And so it is harder to place these older kids and larger sibling groups. That's a lot to take on. And so we're hoping that with these incentives, maybe folks will open their hearts and open their homes to these older kids and these larger sibling groups.
Leader Camper, you have a follow-up?
Yes, ma'am. Thank you, Madam Chair. And this particular request is specific for teens and
Large sibling
large
groups.
sibling groups.
Yes, ma'am.
Okay. Thank you. Thank you, Madam Chair.
Commissioner, can you tell us for, I don't know what the proper terminology would be, but for a child who comes into DCS custody, who's looking for foster placement, who doesn't require additional services, they're just a normal child in a bad situation, are we able to, what is the wait time on placing a child like that into foster care at this point?
That child probably waits a few hours, less than a day.
And the wait time for an older child who, again, no particular issues, or you said older children, people are more willing to take on a toddler, a baby, but an older child, are they placed as quickly as well?
The older child, the more difficult child to place is 22 days.
Okay, but again, those are not children with mental health issues or other issues. Those are just children who fall outside of the spectrum of where foster parents normally focus.
That's correct.
All right, thank you. Chairman Hawk?
Thank you, Madam Chair. And just to expound on your last question, you mentioned 22 days for the older youth. Where do they stay in those 22 days?
Either in offices or transitional homes.
Well, that just contradicts what you just said a few moments ago, that we are talking about trying to help foster care, incentivize folks to get into foster care, so we don't have that 22-day stay in DCS offices or transition care.
No, I'm saying they are staying in offices or transitional homes for 22 days.
And there is a relationship between foster care and staying in DCS offices.
I'm saying they're staying in offices or transitional homes for 22 days before they are able to go into foster care, if we can get them into foster care. But many times they then disrupt and then they come back into the office.
Okay, thank you. We're speaking two different languages. We'll catch up after the meeting. Thank you, Madam Chair.
And again, I think there's some confusion here about a child that is disruptive. That's not the child I was talking about. I'm talking about just a normal teenager, again, through no fault of their own. Their family situation is deteriorated as to such that DCS is involved. The placement time for them from coming into the system to going into foster care is that 22 days?
That's an average of
That's
22 days
Okay.
it takes to place that child.
Again, and I would just ask that the department give some serious thought to Representative McKenzie's comments earlier. We passed legislation in the last session to enhance relative caregiver, to enable grandparents, uncles, aunts, whatever, to take care of a child. So as you continue to look at ways to get that placement time down, 22 days is a long time for a child to be just swinging in the wind. So I would encourage you all to consider that as one of the options. And when you look at funding and process, Representative Parkinson, I believe you had a follow-up question.
Well, no, I don't have a follow-up question, Madam Chair, but I may be a little out of order, but these two young ladies walked into the room. If they'll stand up, please. The one on the left is my daughter, Kirsten Parkinson. The one on the right is Madison, my goddaughter. And they were here for a college visit to Tennessee State University. So if you can make them feel welcome, I'd greatly appreciate it. And
You're very welcome. Representative Parkinson, last
this is
thing.
the last thing, Madam Chair. Madam Chair, I don't know if y'all remember, but the one on the left, when I did my swearing in, she was leaning up in the well, leaning up against the podium, looking like she was extremely bored. Right. And so I don't know if y'all remember her. She was 5 years old at the time. So just wanted to let you know that. Thank you, Madam Chair.
All right. I don't see any other questions. Commissioner, again, we thank you for being here today. I know that it's a very difficult task facing you and your department, and a task that our state has not performed well. So we're looking to you to change that. We want to be helpful in any way that we can. Hopefully the direction that you're heading here with increased beds and some of these other things that will be happening with the supplemental funding will do that. Another question, I'll just warn you ahead of time, I think we'll probably drill down on this along with many other things, but there's a real concern about caseworkers where we're going to get them, how you're going to train them, how are you going to, what the retention level is. Because the last number I saw, I think your vacancy rate was over 600, which means that leaves those who are behind a lot more work to do. So again, I think there's going to be a lot of interest from this committee about how we're going to address those vacancies and fill those with qualified folks. So again, thank you for being here today. Any closing comments? All right. Thank you, members, and we are adjourned.